live chat today with Dr. David Balis. Dr. Balis is the director of our Nicotine Cessation Program here at UT Southwestern, as well as Parkland Hospital down the street from us. We'll be talking about vaping. As usual, don't forget to like and share this conversation. It'll be available afterwards to ask questions, but we'd love to get those questions during our chat so we can have Dr. Balis answer them live for you. So Dr. Balis, thank you for joining us.
Sure.
Yeah, it should be, we hear vaping on the news all the time. It's on NPR, it's on TV, it's in the newspapers. Can you tell us what it is and why is it so popular?
Absolutely. Well, I think of it as smoking 2.0, sort of the new smoking. Basically, there's a battery that heats a liquid that creates a steam or vapor that is inhaled into the lungs. And so it's different than the old traditional combustible cigarettes where there was a fire. This is a battery that heats the liquid. And initially we thought it was possibly safer than the traditional cigarettes. But unfortunately, with this new disease, we've learned that maybe it's not as safe as some people think.
Okay, yeah, that was definitely on the NPR story this morning. So sounds like vaping is not safer than smoking. Is that correct?
Well, again, initially we thought that maybe we could even use e-cigs or vaping to help people quit smoking. Again, with this new outbreak of this disease that we'll talk about, obviously is not as safe as people were thinking. Unfortunately, even the e-cigs itself are new. We hadn't had time to study it, and now we're learning that basically all tobacco products and nicotine products are dangerous and have risks. And with this new outbreak of this disease is very concerning. And so I'd say that initially people thought maybe they could use it to help people quit smoking. But unfortunately, as you know, it became very popular with the kids and teenagers. And so they started marketing it to teens and young adults. And there were lots of flavors that were popular with the kids. And so it's become very popular with our young adults and has become a big concern.
So what makes vaping so dangerous? Is it just that there's no filter, it just goes straight in, or was it another reason?
Yeah, great question. Again, this is all so new. So again, this outbreak of this disease, and it's nice that the CDC has now given it an actual name. It's called EVALI, which stands for e-cig or vaping associated lung injury. That we've been hearing on the news as of last week. I heard there were 1,500 cases of this disease associated again with e-cigs or vaping in the United States, and as well with 33 deaths associated with this new disease. Again, it's called EVALI or EVALI due to e-cigs or vaping.
So how would somebody get diagnosed with EVALI?
Great question. Again, this is all brand new, and it is a little difficult because there's nothing specific about this disease. It presents just like other lung diseases. So it could look kind of like if someone had a severe influenza or the flu or severe pneumonia. There's no specific aspect of it that's going to say it's due to e-cigs or vaping. And so from the physician point of view, it would be important to take that history and get that history. And basically it's something we call a diagnosis of exclusion. We have to rule out all the usual causes. And if we don't find one of the usual causes of this, and the person is using e-cigs and vaping, then we would put this high on our list of possibilities.
So do you know, and granted, and I recognize that this is all very new, there are a lot of things we don't know, but do you know what is causing the lung injury?
Great question. And bottom line is no, we don't know what's causing it. And so we're not sure, is it the nicotine? Is it, as you know, people don't just use nicotine in the e-cigs or vaping, they use THC and other things. Is it the THC? Is it the chemicals in the liquid that are associated with this? Is there some additives or contaminants that's being added? There's a report about vitamin E. There's all kinds. So the bottom line is we don't know what's causing it. And so because of that, we would recommend that people not use e-cigs or vaping at the moment because we don't know exactly what's causing it. Again, there's a thought that more of the cases are associated with THC, but there are cases associated just with nicotine. And maybe more of the cases are people who got their e-cigs or vaping device on the streets as opposed to from a more traditional seller. But again, it's all new. The CDC is looking into this so we can learn more about it. They're taking samples from people's lungs to try to learn more about it. So we can describe what this disease is, what is causing it. It's also interesting, they're trying to collect the actual e-cig or vape devices, so we can study those devices to see what was in those that's causing it. So bottom line is we don't know, but hopefully we're going to study this and learn a lot more about it.
Okay, it sounds like there are a lot of unanswered questions that we're trying to figure out. Well, we're starting to get some questions in from our audience. Thank you all for joining us. Looks like we've got a good crowd going. The first question is, what would you say to people using vape pens as a way to quit cigarettes?
Yes, so again, initially that was thought that maybe we could use it for that, but unfortunately I would say the data don't always support that a lot of times people will smoke in the morning in their homes when they're able to do that. When they go to work, they're not able to smoke traditional cigarettes. They use their e-cig or vape, and then they go home and smoke cigarettes, and so they just are using it as another nicotine delivery device, and they're not really quitting, they're just kind of using smoking and e-cigs and not really quitting. But again, due to this outbreak of this disease, we're very concerned, and this is a very serious disease. People winding up on breathing machines and ventilators. It's not just a mild disease, this is a very serious illness. And so we're recommending that people not use these devices. And I would say that instead of using the e-cig or vaping to help them quit smoking, that we have FDA-approved medications to help people quit, and that we need to focus on using those medications as well as counseling to help people quit. So we have proven methods of helping people quit smoking, that we ought to use those and maybe not e-cigs and vaping.
Okay, that's a perfect segue to our next question that came in from our colleagues over at the Cancer Center. They wanted to find out, what resources does Simmons have to help people quit?
Glad you asked that question. So we have a nicotine cessation program here at UT Southwestern, where we have a free clinic that we will see anyone who smokes or use any type of other nicotine or tobacco products, and we will help them quit. And the bottom line is we think that people need counseling and medications, and we need to combine those together. And so I have 3 wonderful trained tobacco specialists to provide counseling, and we have group therapy, we have individualized therapy where we see patients one-on-one and provide them with medications. And we again combine the counseling and medications. Again, we think that people smoke because of the habit as well as the addiction to nicotine, and so hopefully with the counseling and medicines we can deal with both of those aspects. But we would love to see patients here in our clinic and help them quit.
Great. Well, we'll share a link to the Nicotine Cessation Program in our chat dialogue here. Can you tell us a little bit about what does that look like? How does somebody get involved in that program? Do they just pick up the phone and call? Do they just show up?
Great question. For our patients here at UT Southwestern, they may be referred by their providers when they're seeing other doctors who may want their patients to quit. They often will be referred, and when the referral is made, we'll contact the patient and happy to see them. But we're also seeing patients who find us just online and on the web and aren't established patients here, and so we're happy to see new patients to our system or established patients here, either one, and we're happy to see anyone and do our best to help them quit. Okay,
sounds great. So we've got some more questions in. I see them coming in. Wanted to get in, make sure we talked about the Nicotine Cessation Program. Here's one from Tony. Tony's question is, I've heard a lot about the potential side effects of those FDA smoking cessation medications, particularly as it relates to suicidal thoughts. Have they been overblown by the media? Interesting question.
Yes, so briefly, there's three big options of medications that we use to help people quit smoking. There's nicotine replacement. People are often familiar with the patch and gum that are over the counter. That's one option. The second option I talk to people about is a pill called Wellbutrin. It has three names. It's also called bupropion or Zyban. It's a pill that we use to help people quit smoking. And then the third option in general is a pill called Chantix. And I believe the person asking the question may be referring to Chantix. And I hear a lot of questions similar to that. We in this field think that Chantix is actually the best medicine to help people quit smoking, but it does have, unfortunately, this stigma in the community about some potential side effects that I think have been overblown, that the studies don't support, but people do have some concerns about Chantix. But again, I try to remind patients that the risk of smoking traditional cigarettes is enormous, with 500,000 people dying every year in the United States from smoking, and 8 million people worldwide die every year from smoking. And so the risk of smoking far outweighs any possible risk of these medications. But yes, obviously any medication could have a possible side effect, but then again, try to get people to try medication. If it works for them, fantastic. If it doesn't work, you can always stop it. And
well, and it sounds like the programs here, at least that we have, you may have medication, but you combine that with counseling and group sessions, so it's not only medication.
Absolutely, right? It's not just about the medication. Yes, counseling is important to change people's habits and behaviors and give them tools to help with that. And again, people have choices is the bottom line, and they get to choose what works best for them.
Okay, good to know. Great question, Tony. Thanks for joining and thanks for the question. We've got another one here. Is vaping as addictive as smoking cigarettes? Sounds like the answer is yes.
Yes, and actually, some people are concerned that maybe even more so. But yes, there's so in the liquid, in the e-cig and vaping, one can adjust the dose or the strength of the nicotine liquid, but it is very potent, and particularly with these newer devices, people are getting hooked on nicotine, absolutely. And so that's the concern we have, particularly with the younger generation, is that the big picture is that since 1964, when the Surgeon General's report came out, the incidence of smoking has come down now to about 15% of the population. But we're concerned that we're going to get a whole generation of kids hooked on nicotine, and we're going to go the wrong way, and we're going to increase and go back up. And so that's our big fear. But yes, it's very addictive, and that's the problem.
Good question, Christy. Thanks for joining us. Here we have one from Anna, and this directly relates to that. And we may not know the answer to this, but it's how quickly can teens become addicted? So can they become addicted quicker than adults can?
Great question. So the developing brain of teenagers, we know, is a little bit different than sort of the adult brain, which is more stable, and that teens are very susceptible to being addicted. So they think they're invincible. As everyone knows, they have may choose to have some behaviors that are a little risky, and we think that because of their developing brain and their risk-taking behaviors, that they are highly susceptible. And so that's a big concern, absolutely.
So what should parents do in that case? What should they know about it?
Well, they should first know that lots and lots and lots of kids are doing this. And they may not recognize it, they may not be aware of it, but many kids are doing it, or they're at least seeing it and being exposed to it and aware of it. So they need to know it's out there, that they may think of, as opposed to a combustible cigarette, there's the older e-cigs that sort of have the steam at the end. But then we have the newer devices that parents need to know about, like the Juul devices that look like a little flash drive. So it looks nothing like a cigarette, or even the traditional long e-cig with the vape coming out of it. It looks like a flash drive. So parents may not be aware that their kids have these, and kids may be using it, at school, in the bathrooms, all kinds of places, because they can hide it, and it just looks like a flash drive, and they look like they're doing homework.
Wow.
Another important thing that parents need to know is it's not just nicotine, that this is a drug delivery device.
Okay.
And nicotine can be the drug of choice that you put in these, but people can use other drugs, such as THC or marijuana, can be used in these devices. So parents need to know, maybe nicotine, but it may be other things, again, like THC that they're using in these devices.
Wow, it's a scary time for parents.
Yes.
Good to know. Okay, well, we've got a question in here from Christy, and she's wondering, what are some alternative ways to deal with stress for those who have typically relied on nicotine?
Great question. Yes, stress absolutely is a big part of smoking. People often will get upset, get stressed, and go outside and smoke and come back. And I try to convince patients that that's not the answer, that it doesn't help, that we need to find, but we need to find healthy ways to cope with stress, and we need to find real solutions to the problems, not use drugs like nicotine to try to deal with it. So again, healthy ways to cope with stress. Can
exercise?
Absolutely.
Okay.
Whatever hobbies they like, can they exercise? We also try to encourage patients to use distractions instead of smoking. Can patients chew some gum, use some candy, go for a walk, listen to music?
Something to get that mouth doing.
Absolutely, right? So we got something to distract the hand, mouth, and mind.
Okay.
And so yes, commonly you're talking to patients about healthy ways to cope with stress. Exercise is a great one. But instead of smoking, thinking about these healthy ways to cope with stress and distractions is obviously very important.
Okay, good question, Christy. I saw a question in here from, we had a question from Lee that it looks actually like he is sharing a comment. He said, I quit smoking 6 years ago using vapes. He said, best thing I ever did, tried all the other options, no success. So is there, to Lee's point, he said he used vaping to stop. I mean, is there anything helpful there? Well,
it's great that Lee has stopped smoking traditional cigarettes. And again, I would consider both the medications and I guess in the past, the e-cig as a tool. So the medicines aren't forever to help people quit smoking. They're for a period of time to get people off traditional cigarettes. And so I would say, at least in the past, if someone used e-cigarettes for a short period of time to quit traditional cigarettes, but then we're able to get off the e-cigs, then that's fantastic. The concern is, are they continuing to use the e-cigs, or again, if you can use it as a tool, just like the medications for a period of time to help you get off, and then we need to get off all of the medications and all of the e-cigs and stop completely, but it's a tool short term to help people quit.
Okay. All right, good to know. Thank you for joining us, Lee, and for letting us know about your success. That's great to hear. So I know we only have a couple minutes left, so if you have any questions, please submit them now. We talked a lot about, what parents need to be aware of. What if, what can family members do to encourage their loved ones to stop smoking, whether it's cigarettes or vaping or something else?
Yeah, great question. Would ask, families to gently encourage their loved ones to not smoke, not to pound them too hard on the head all the time. That can backfire and gets old for the patient who's smoking. Encourage them again to put the person in situations where they're not going to be enticed to smoke. So we can kind of keep them busy. Again, use these distractions. Be in situations where smoking isn't available. And then one thing I think families can do is sort of give incentives, particularly for a teenager or young adult. Could you sort of make a deal where if you're not going to use these products, then I will get you something that they would really desire or like, whether it be a phone, going to a concert, a car, college education, some money. I mean, could we really incentivize them?
So bribe them.
Somewhat, but I think it's worthwhile to have that discussion. Is there something that they could entice their loved one with? Or again, if it's a peer, could you go to a fancy dinner? Could they get a gift, but some kind of carrot to help with that process, or things that family members maybe could help with?
Okay, good to know. So we've got time for maybe 2 more questions. We're going to take this one from Christy, and her question is: now this is not cigarettes, but is chewing tobacco as dangerous as vaping?
Great question. It is absolutely still dangerous, maybe not quite as dangerous, but absolutely still dangerous. We're concerned mostly with oral cancers related to chewing tobacco, and so we still see patients who use dip and snuff and oral tobacco, and it's still dangerous. Again, concerned about the oral cancer, and we treat it similarly, and may offer medications, particularly like the nicotine gum, to help those patients quit. And note that where it was very popular in baseball, that baseball has been good at trying to take that out of baseball and not encourage young people to use that.
I've noticed that in the games. You don't see quite as many people along down there in the dugout. But all right, we've got the last question here. This one's from Tony. It's, after quitting vaping, how long does it take for nicotine to be absent from a user's system?
Great question. Well, I'd say one thing that we do in our nicotine cessation program is we measure carbon monoxide as a marker of how much people are smoking and when was the last time they smoked. Physicians may also monitor other levels of nicotine or metabolites of nicotine to see, is a patient smoking. So I can say that, so we use this as a tool to encourage patients in one's carbon monoxide level, which is a dangerous poisonous gas that's in every cigarette and is lethal, that very quickly goes away. And nicotine similarly does go away quickly. And so lots of benefits of quitting, and again, encourage people to think about all the benefits of quitting.
Okay, great question, Tony. That is all the time we have today. I want to thank you, Dr. Balis, for joining us.
Thank you very much.
Thank you for answering all of our questions. It's been great. As usual, this chat will be available here to share with your friends, and we'll also upload it to our YouTube channel later this afternoon. So please share far and wide, and we'll see you next time.